Hello, my name is Alejandro, and today I'll be presenting on multiple sclerosis. Typical patient presentation. A 20-year-old female presents with paresthesia in her right arm, abnormal sensation of the skin, tingling and numbness for the last several months. She reports weakness in both legs leading to an impaired gait. Last week, she had several occasions of urinary incontinence. Most recently, she reports visual disturbances and episodes of slurred speech. She has lived in Chicago since birth and spends most times indoors. She has no known medical problems. Etiology of the disease. Multiple sclerosis is a complex neurodegenerative disease affecting the central nervous system. The etiology is currently unknown. However, there are several theories about what it is that causes MS. One leading theory is that it has to do with location. Researchers have found that most cases appear in clusters on a map. They are found around the same place, around the same time. Researchers have also found that individuals who move assume the risk of MS from their new location, meaning if someone is in a low-risk area, typically closer to the equator, and they move up north, they then assume the higher risk of contracting MS. Another theory is vitamin D. Sun exposure may be why there are less cases closer to the equator, as I just mentioned. Smoking. Smoking can increase the risk for MS. Ending smoking will also slow the disability from MS for individuals who already have MS. Obesity. Obesity increases the chances of MS. Obesity will also accelerate MS activity. Background. Approximately 1 million people are living with MS in the United States. MS is usually found between the ages of 20 and 40 years old. However, it is important to note that kids can get MS as well. 20 and 40 years old is just the age where it's typically found. MS is more common in areas furthest from the equator. This implies that there is an environmental risk. MS is more prevalent in women than in men. Women are 3 times more likely to be diagnosed with MS. MS is most common in Caucasians of Northern European ancestry. This implies a significant genetic risk. Risk factors, variables associated with an increased risk of the disease. A lot of these I've already mentioned with the theory slide, but I'll go over it again. Gender, again, it is more common in women than in men. Smoking. People who smoke are at higher risk for MS. Vitamin D deficiency. This is the reason why there's a theory of why MS is more prevalent further away from the equator. Epstein-Barr virus infection. This implies that there is a possible autoimmune process. Pathophysiology. Like most diseases, there seems to be genetic and environmental factors. The pathophysiology is believed to be autoimmune in nature. The body produces antibodies directed against normal host tissues. On the next slide, I'll show what that looks like. Plaques form in the CNS, combined with inflammation, demyelation, axonal injury, and axonal loss. Plaques are found in the brain and spinal cord. This picture shows what a normal nerve and the nerve of someone with multiple sclerosis looks like. In the normal nerve, we have healthy myelin sheath. In multiple sclerosis, we could see that the myelin sheath has been damaged. The immune system has attacked the myelin in a process called demyelination. In early MS, the myelin sheath will recover, however, it'll just be scarred. In late MS, This is a continuation off of that picture. So in the normal nerve, we had the myelin that surrounds the axons of neurons, enabling the sending of electrical impulses. As I mentioned in MS, due to demyelination, we will have a breakdown in the communication of neurons. This will begin to lead to sensory, motor. Here I've provided a recap of the previous slide. So first, the macrophages will attack the oligodendrocytes. Next, we have sclerosis. We're going to have scars on the myelin sheath. After that, we have remyelination. This is when the oligodendrocytes heal and the myelin heals. In late MS, with time, the oligodendrocytes die and remyelination stops, because without oligodendrocytes, there's no remyelination. Lastly, this will affect nerve transmission. Types of MS over time. On the next slide, we'll go over the 4 different types of MS, but there are 4 main types. There are relapsing remitting MS, primary progressive MS, secondary progressive MS, and progressive relapsing MS. MS has a variable course depending on the type of MS that it is. Each one is different. However, it doesn't matter the type of MS it is. All stages of MS will show a gradual increase in disability as time continues. On the graphs, we'll see remyelination. Remyelination is represented by each drop on the graph. In late MS, as I noted previously, remyelination will stop. PPMS and PRMS have a continuous increase in disability with no remission, and that's represented by the horizontal line. So here we have the 4 main types of MS. If we take a look at RRMS, the top one, we see that there's unpredictable attacks. And after each attack, remyelination will occur, but notice that disability is increasing as the time increases, and that goes for all of these. In primary progressive MS, there's a steady increase in disability without attacks. In secondary progressive MS, we see that the chart resembles a little bit of both the previously mentioned MSs. Here I've listed some of the common symptoms of MS, such as pain, fatigue, bladder dysfunction, bowel dysfunction, depression, and heat intolerance. There's other symptoms of MS, but these are the most common. Diagnosis. There is no specific test to diagnose MS. However, an MRI, cerebrospinal fluid, or a visual evoked potential can help provide support for a diagnosis. For the clinical diagnosis, there must be 2 or more exacerbations. The exacerbations must be more than 24 hours. Relapses must be separated by more than or equal to 1 month. More than 1 or 2 neurological signs must be present. When it comes to multiple sclerosis, the treatment will aim to prevent exacerbations, prevent permanent nerve damage, or control the symptoms of MS. The medications given for people with MS are corticosteroids or immunosuppressants. The corticosteroids will shorten the exacerbations, and the immunosuppressants will reduce the attack to the oligodendrocytes.